Okay, we are going to open this joint agenda between the Committee on Health and the Committee on Transportation in the Senate, February 3rd, 1 p.m. I'd like to welcome the members of the Senate Transportation Committee and thank the Chair for joining us on this joint hearing.
Great to be here.
Okay, so we have one bill on the agenda, that is SB 241, relating to medical cannabis. This authorizes qualifying patients and qualifying out-of-state patients to transport cannabis between islands of the state for personal medical use. And first testifier on our list is the Attorney General. Okay, next we have the Department of Health, Health Resources Administration.
Hi, Chair, Vice Chair, and members of the committee. My name is Tammy Whitney. I'm with the Department of Health Medical Cannabis Registry Program, and the department stands on its written testimony and is available to answer any questions.
Offering comments. Thank you. I'd also like to note that the testimony submitted from the Attorney General offers comments. Okay, next we have Department of Public Safety offering comments. Department of Transportation offering comments. Is Jade on?
Jade is not on at this time.
Thank you. We are going to move to Community Alliance on Prisons in support.
Aloha. Kat Brady from Community Alliance on Prisons. Thank you so much for the opportunity to testify. This is really an equity bill because right now the only dispensaries are on Oahu, Hawai'i Island, Maui, and Kauai. So the people who are suffering on Molokai and Lanai and Ni'ihau have no way to access medicine from the dispensaries, and that's why we support this.
Okay, thank you very much. Thank you. We have a number of individual testifiers who indicated they are supportive of the measure, but did not indicate that they would be present. We also have Mr. Clifton Otto in support. Is Mr. Otto on? Okay. Offering late testimony, we have the Hawaii Cannabis Industry Association. Oh, here he is, Mr. Otto, go ahead. You are on mute, please. Please unmute.
Great, can you hear me?
Yes.
Great, thanks very much for the opportunity to provide testimony on this bill, SB 241. I have submitted written testimony. I just wanted to make a few comments to highlight some of the points in my testimony. This is a very important bill because it's an issue that our patients have been dealing with for decades. Patients really need to be able to travel with their medicine because they're not able to go necessarily to a dispensary on another island and find a product that will be effective for them. This is especially true for patients who are producing their own cannabis medicine. But this issue also is affecting several other stakeholders, namely laboratories that are transporting cannabis between islands. Even though this is supposed to be legal under state law, they're still being restricted by TSA and by local law enforcement because of this belief that they're violating federal law. And this is also something that the hemp farmers are encountering. So I believe that if we are going to address the inter-island transport of cannabis by patients, then it would also be a good idea to take a look at the current federal conflict that is interfering with this. I know that the legislature is dependent upon an office for legal advice on this matter that is hesitant to support the state's sovereign authority to decide how controlled substances are used within the state. But this is something that really needs to be taken a look at, and especially with other bills that are being made available this session to address possible options for solving the current conflict with the federal regulation of marijuana. So thank you very much for the opportunity to testify on this measure. Aloha.
Thank you very much. And thank you very much for keeping your comments to almost exactly 2 minutes, which I wanted to note again for the committees. We are requesting testifiers limit their comments to 2 minutes so that we can keep within this tight schedule and pass as many bills as we can. Offering late testimony, the Hawaii Cannabis Industry Association in support. Okay, and the Marijuana Policy Project testifying in support. Devon Ward, is he available?
The chair, he is not available at this time.
Okay, that's all the testifiers I have listed. Is there anyone else on the call who would like to testify in this measure? Okay, seeing none, members, questions? Okay, seeing none, I'd like to move into decision making. Chair Lee, do you have quorum? I don't believe so. Oh, I think you do.
Yes, I think we do.
You do. You have English and Tagalog.
Okay.
Can you bring the
So,
vote sheet, Arwen?
I've got it right here.
Do we have our vote sheets ready?
Yes.
Okay, great. So we're going to move right into decision making. This measure was passed
Need a black pen.
last year and was vetoed by the governor. We have a new federal administration that is likely to have a different policy as it relates to cannabis, especially as the industry and medical cannabis in general has changed so drastically over the last several years nationally. So I am going to recommend that our committee pass this measure out unamended. Any comments or questions? Okay, seeing none, Vice Chair, can you please take the vote? Chair votes aye.
Vice Chair votes aye. Senator Moriwaki.
Aye.
Senator San Buenaventura.
Aye.
Senator Favela. Excused. Measure passes 4 ayes, 1 excused.
Thank you. Community Transportation.
Reservations.
Oh, sorry. Okay, I'll change you to reservations. Thank you.
Thank you.
Thank you.
And Community on Transportation, same recommendation. Any discussion, any comments? If not, Chair votes aye. Vice Chair is, I believe, excused.
Line 2, page 2, line 2,
The last one.
line 10, and line 16.
Senator English?
Also, page 5 and
This is the
14.
one she's reading now.
Some of the
Somebody's
Thank you.
mic is on. Yes.
mixed
Sounds like Lorraine.
Senator Shimabukuro?
Aye.
Thank you. And Senator Favela?
Aye. Oh, reservation, sorry.
Reservations for Senator Favela. Thank you. Measure passes. Oh, Jarrett, unmute.
Steve and I do it. So we're about to move into the 1:05 p.m. health agenda, members. This 1 p.m. joint agenda is adjourned. Cannabis clones and cannabis clones by medical cannabis dispensary licensees. Again, I'd like to ask, in the interest of time and expeditious processing of testimony, if the members of the public who are testifying can please limit their comments to 2 minutes, and if they'd like to be available for questions from the members after testimony is received, to please stand by on the Zoom call. First up, we have the Attorney General offering comments. Okay, Department of Health, Health Resources Administration in opposition. Okay, Big Island grown dispensaries in support.
They didn't allow it.
Department of Health, would you like to testify?
Yes.
Yes, please.
Okay, can you please turn your video on and identify yourself?
Sure. Aloha, good afternoon, Chair Keohukalole and Vice Chair Baker, Michelle Nakata for the Medical Cannabis Dispensary Licensing Program. The Department of Health stands on its testimony in opposition, and we are available for any questions the committee should have. Thank you.
Okay, thank you. And let me see. Clifton Otto offering comments. Hawai'i Cannabis Industry Association in support. Okay, that's all the testimony we've received. Is there anyone else on the call who would like to testify on this measure? Seeing none, members, questions? Okay, I have a question for the Department of Health. Okay, so it looks like in your testimony on this measure and the next measure, one of the concerns you cite are the possibility of the proliferation of currently existing grow sites that contain homegrown plants for an unlimited number of patients. And the concern there is that this bill will exacerbate the problem.
Yes.
Would the department like to offer a solution to that problem since it exists already in the dispensary framework and you note it as a concern?
I think there are several possible solutions. One of them would be to limit the number of cards that could be registered to a specific grow site. But another major problem is the lack of enforcement capacity. Although the Department of Health does have the authority to verify that a patient is within their plant limit count, we really do not have the personnel to be able to go and enforce the grow sites. Law enforcement, and we probably don't have the appropriate skill set. Law enforcement does have the proper skill set. However, they do not have the authority to enter unless they're accompanied by the registry program personnel. So if there was a way to increase the department's ability to enforce plant count limits, as well as implement measures to limit the number of grow sites, of number of cards that can be registered to a specific grow site. We believe that those measures combined would be one way to limit the risk of patients exceeding their statutory plant limit, as well as limiting illegal growing operations. Thank you.
Thank you. Members, any follow-up questions?
Chair,
Senator
I have a
Moriwaki.
question. Department of Health, thank you. So I can see it with the seeds and the clone, but the edible cannabis products, they are manufactured. Is there a better way in terms of those products to be able to enforce and are you also opposed to that?
Edible cannabis products are produced by the licensed manufacturers. We are in the process currently of drafting administrative rules that will cover the safe practices for manufacturing, similar to how other commercial food products and dietary supplements are manufactured.
So as part of this bill that includes the manufactured products, you're not opposed to that. You're opposed to the seeds and the clone.
We would not be in support of an unlicensed facility manufacturing products. So that would be another concern, yes.
So there'd be no way to address that in amending this bill to identify licensed manufacturers?
Correct.
Okay. Thank you, Chair.
Okay, members, any other questions? Okay, seeing none, we're going to move to the next measure, SB 254. This bill is related to cannabis for medical use. It authorizes medical cannabis dispensaries to distribute cannabis, propagules and cuttings to individuals authorized to cultivate cannabis plants for medical use, subject to quantity limits and quality requirements. First testifier is the Attorney General offering comments. Okay, we're going to move to the Department of Health in opposition.
Aloha Chair, Vice Chair, committee members, Michelle Nakata again for the Department of Health. We stand in opposition to the written testimony that we submitted, and again, available for any comments or questions.
Thank you. We also have Big Island grown dispensaries in support. Okay, that's all the testimony we've received. Is there anyone else who would like to testify? Members, any questions? Okay, moving to the next measure, SB 629. This is relating to medical cannabis. It allows primary caregivers, qualifying out-of-state patients, and caregivers of a qualifying out-of-state patient access to the restricted access area within a medical cannabis retail dispensary. It also clarifies violations related to medical cannabis dispensaries. Attorney General's office offering comments. Big Island grown dispensaries in support. We also have late testimony from the Department of Health in support.
Aloha, thank you. Our apologies for the late submission of our testimony. We do support SB 629, stand on our written testimony and available for any questions. Thank you.
Thank you. And also offering late testimony, the Hawai'i Cannabis Industry Association in support. Okay, that's all the submitted testimony I see. Is there anyone on the call who would like to testify? Members, questions? Okay, we're going to move on to Senate Bill 1139, relating to the Office of Medical Cannabis Control and Regulation. This bill increases patient registration fees by $10 and adds 3 full-time positions to the office and changes the means of finance for those positions. First up, we have the Department of Health in support.
Good afternoon, Chair, Vice Chair. Danny Wong Tomiyasu, Department of Health. The department stands in strong support of this measure. We do want to note there is an error in the bill that it's on page 3, line 4. The request should be for the biennium, not just for 20 to 21. So I wanted to note that. And secondly, we respectfully would like the legislature to consider an amendment to allow patient registration to be established in administrative rules versus in statute. Thank you for the opportunity to testify.
Thank you, Danny. Next, we have Clifton Otto offering comments.
Hello, thanks for the opportunity to comment on this measure. Dr. Clifton Otto, cannabinoid medicine specialist in Hawaii. I just wanted to highlight 2 comments in my testimony. One is I think the record shows that there are some deficiencies in the current ability to regulate Hawaii's medical cannabis program, and I'm proposing that the program be moved from its current administration over to a different administration that includes the food safety branch that I believe has the capabilities to fill some of the needs for dispensary regulation that have been lacking in the past. I would also like to propose that one of these full-time positions that is being considered for OMCCR be specifically for a certified cannabinoid medicine specialist, so that the department can have certified medical expertise available to the program to help with decision-making and enforcement. Thank you for the opportunity to make these comments.
Thank you, Dr. Otto.
I'm available for questions if there are any. Thank you.
Thank you. We also have late testimony submitted from the Hawaii Cannabis Industry Association in support. Okay, is there anyone else on the call who would like to testify? Members, do you have any questions? Okay, oh, Vice Chair.
Yes, the question is for Dr. Otto. You heard the description of the kind of person that would be useful in this office. I know that you consider yourself qualified for the description that you laid out. Are there others in the state of Hawaii that would qualify as well?
There are currently 3 physicians that I know of who meet this qualification. I'm still waiting to hear if the nursing organizations have developed their own certification. I think they're still working on that. And my hope is that by requiring such a position, that would encourage other physicians to complete certification programs that are available through national accrediting organizations for physicians who would like to gain this expertise.
Can you share with the committee what those organizations would be?
So the one that I went through was the American Academy of Cannabinoid Medicine. This is a national accrediting organization for physicians who are looking for this type of certification. And it requires a certain number of years of practice in cannabinoid medicine. It requires getting a certain number of continuing medical education credits, which requires going to national conferences across the country. And it also requires taking an examination. The American Academy of Cannabinoid Medicine is one organization that I would refer physicians to who are interested in this.
And do you know if this organization is listed in any other state laws in terms of practitioners?
I don't know any other state laws that require this type of position. I wish that they would, because I think that this would offer a certain level of expertise that I believe certifying physicians and APRNs should possess if they are going to do these written certifications. And I would also hope that our state medical board would adopt guidelines that would require these types of certifications to make sure that our certifying providers have the knowledge and experience to properly certify and provide medical supervision that our law requires.
Thank you, Chair.
Thank you. Members, any other questions? Okay, seeing none, we're going to move to the next measure on the agenda, Senate Bill 1141, relating to Hearing and Vision Program. This amends the Hearing and Vision Program statute to increase the early identification of children with hearing or vision loss by establishing consistent protocols for hearing and vision screening and follow-up, screener training, and data collection for quality improvement. First up, we have the Disability and Communication Access Board in support. Hawaii Children's Action Network in support. The Hawaii Optometric Association in support. And it looks like the Department of Health, Health Resources Administration in support.
Good afternoon, Chair. My name is Matthew Shim. I'm Chief of the Family Health Services Division. The department is in strong support and we stand on our written testimony. Thank you.
Thank you very much. That's all the testimony we've received. Is there anyone else who would like to testify on this measure? Okay, members, questions? Okay, seeing none, we're going to move to the next item on the agenda, Senate Bill 1145, relating to the disclosure of vital statistics records. This amends and appeals sections in Chapter 338 Hawaii Revised Statutes to allow the Department of Health to disclose vital statistics records for public health and law enforcement purposes, and updates the eligibility requirements for access to confidential vital records. First up, the Department of Health in support.
Good afternoon, Chair, Vice Chair, members of the committee. Lauren Kim, Acting State Registrar and Policy Director for Hawaii Department of Health. I'm going to stand on our testimony in very strong support of this administrative bill, which would make access to public health records for legitimate government and research purposes that much easier while still maintaining the privacy and confidentiality of them. Thank you, and I'm available for questions.
Thank you, Lauren. And next we have the University of Hawaii, Mr. Holcomb, in support. And offering comments, the Office of Information Practices. Okay, that's all the testimony we've received. Is there anyone else on the call who would like to testify? Okay, members, questions? Okay, great. Moving on to SB 1150. This bill is relating to skilled nursing facility licensing and authorizes the Department of Health to recognize national accreditation or certification organizations. First up, Department of Health in support.
Good afternoon, Chair, Vice Chair, members of the committee. This is Keith Ridley on behalf of the Director of Health. We'll stand on our testimony, but I'd like to summarize just by showing out four specific points in our testimony. One is that this bill seeks to essentially mimic Section 321-14.5 in HRS of being able to recognize an accrediting organization for hospitals. This would do the same thing for skilled nursing facilities. The second point is that our office, the Office of Healthcare Assurance, currently conducts the Medicare certification surveys. So we're actually going in and doing two surveys simultaneously, one for Medicare recertification and the other for state licensing. So we're already in there. The third thing is that the department would be able to, with this bill, would be able to accept accreditation surveys from other organizations, but also from on the Medicare recertification survey, again, which we do. The fourth item to point out is that this information would be a matter of public record. We will post this on our inspection report, just as we have very recently posted the federal inspection reports on these on the surveys that we've done recently at the Yukio Okutsu State Veterans Home. That's all we have. Thank you so much.
Thank you, Mr. Ridley. Next, we have the Healthcare Association of Hawaii offering comments. Okay, and next we have Dr. Jim Sean in opposition. Okay, that's all the testimony we've received. Is there anyone else who would like to testify? Members, any questions?
Chair, I have a question of
Senator Moriwaki.
Keith, hi, how are you? I just wanted to be assured that when we've got this Medicare licensing, that they also will be inspecting on sites inspecting, or is this just, you know?
Senator, can you repeat the last part of your question? You
Okay.
cut off.
My concern was, you know, we have this accreditation that provides for annual renewal, but I'm just wondering, the concern was having an on-site inspection. So are they, as part of that renewal, also doing a physical on-site inspection annually?
Yes, when we go in and conduct an inspection on behalf of Medicare and state licensing, this is on site and they are both unannounced.
Okay, that's good. Thank you, Chair. Just wanted to be assured.
Okay, members, any other questions? Okay, seeing none, we're going to move to the next measure, SB 1151, relating to hospital licensing. This authorizes the Department of Health to recognize additional national accreditation or certification organizations. Department of Health in support.
Hi again, Chair, Vice Chair, and members of the committee. Keith Ridley on behalf of the Director of Health. Essentially what we're trying to do is use the same recognition for other national accreditation organizations that the U.S. Centers for Medicare and Medicaid Services also recognize. We also thought that it was probably not a great idea as a matter of policy to specifically name one individual private entity in statute when other private entities that do the same kind of work are also available in the community. And that's all the testimony we have. Thank you.
Thank you very much. Kaiser Permanente, oh, I'm sorry, the Healthcare Association of Hawaii, Paige Choi, offering comments. Kaiser Permanente in support. Okay, Dr. Susan Nelson in opposition.
Thank you. My name is Dr. Susan Nelson. I am the president of the medical staff of the Hawaii State Hospital here in Kaneohe. We stand on the written testimony which opposes this bill, and we thank you for the opportunity to speak. The medical staff of the Hawaii State Hospital is responsible for the clinical oversight of caring for patients as well as their treatments and other services. As we are the licensed medical and clinical providers of services, we are charged by the federal government to be responsible for the patient's medical and psychiatric treatments. The patients at Hawaii State Hospital, which I want to emphasize is a public hospital governed by members of the Department of Health, are some of the sickest patients in the Hawaiian Islands. They are unable frequently to advocate for themselves, and some of them are violent. We believe that the rigors of the Joint Commission specifically, which was also specifically identified by the Department of Justice as part of its ending of investigation of the hospital back in the 90s, is critical for maintaining the best care that we can give to these very vulnerable patients. I have no further comments, but I will be happy to answer any questions when appropriate. Thank you very much.
Thank you. Up next, we have Dr. Jamie Stevens in opposition. Okay, and Marva Lawson in opposition. Please go ahead. Please unmute. Thank you.
Okay. Good afternoon. My name is Marva Lawson. Thank you for the opportunity to testify today. I oppose Senate Bill 1151. I consider this to be a parity bill, and I'll explain why later. Senate Bill 1151, if passed, would replace 321-14.5 and authorize the Department of Health to recognize additional nationally recognized accreditation or certification organizations to demonstrate a hospital's compliance with all licensing inspections required by the state. Currently, we're accredited by the Joint Commission. The Joint Commission is recognized as the gold standard. Any hospital or healthcare organization accredited by the Joint Commission is internationally recognized as complying with the gold standard in the provision of the highest quality care, treatment, and services. The ones listed in the bill do not adhere to the same rigorous standards, and the potential for cutting corners places not only our patients, who are the sickest, most vulnerable, and disenfranchised population, and the public as well to increased risk. In conclusion, the Joint Commission accreditation aligns with HSH, or Hawaii State Hospital's mission, which is to provide excellent inpatient psychiatric services for court-ordered individuals within a safe and therapeutic environment. My own personal story, I have a family member who is impacted by this bill. As a mother of an African-American son who has a mental illness, I am deeply concerned and hope that all share my concern about the standards for accreditation for hospitals. As such, it's imperative to me that all hospitals should continue to be accredited by the Joint Commission. That's all I have. Thank you for your attention and time.
Thank you very much. Offering late testimony, Allison Garrett in opposition. And the HGEA in opposition. Okay, that's all the testimony we've received. Is there anyone else who would like to testify? Okay, members, questions?
Sorry.
Vice Chair Baker and then Senator Moriwaki.
Thank you, Chair. For the Department of Health, I just recently reviewed the bill and there's really no findings and purpose. So I'm wondering why this bill is necessary and why we would need to move away from JCAHO accreditation, and if other states do their own, are they similar standards to what JCAHO has? I just don't understand why this bill got put in.
Thank you for the question, Vice Chair. It was simply just to be able to recognize other national accrediting organizations. We wouldn't advocate necessarily for any hospital to change accrediting organizations. but just to show an equal footing in terms of those accrediting organizations that are recognized by CMS, we would do that at the state level as well.
Chair, could I ask a follow-up question?
Please.
So what are those organizations and what track record do they have in Hawaii or elsewhere?
Well, none of those other organizations are in Hawaii. I'd have to look to see nationally how many hospitals the other organizations accredit, and I can provide that information for you once I obtain that, and I'd be happy to do that. But in terms of that kind of a track record, I don't have that information readily available.
Well, that surprises me, Keith, because this is a governor's bill, which means you guys had to put it together. So to not have the information available for the committee is troubling. And I guess I would share a concern that has been raised that we would be lessening the standards. And since you can't tell us what the other accrediting organizations, where they are, what they do, what their standards are, I'm concerned. I just share that with you and with the chair. Thank you.
Senator Moriwaki.
Similar question. I wanted to know what these other organizations were and whether their standards were up to the standard of the Joint Commission. So I too am concerned about not knowing why you're expanding without more information. Thank you. Thank you, Chair.
Thank you, Chair. Thank you, Senator, for that follow-up question as well. These organizations are listed on the CMS website. I'd be happy to share that website with you. It indicates what kinds of organizations are accredited by what kinds of accrediting bodies. And there are contact information there as well. I'll be happy to share that with you as well.
Chair, a follow-up. I think it wasn't so much the names of the organizations, but what are the standards they look at? And are those standards the same as the commission so that, you know, they really are comparable and looking at the same things and that we're not lessening our standards?
Thank you for the follow-up question. The side-by-side table, if you will, of comparison by areas of operation of a facility aren't available. But I know that when these organizations want to be recognized by CMS, they have to apply to CMS, and CMS does a review and determines whether to accept them or not for accrediting hospitals. Once CMS accepts an accrediting organization, the accrediting body then is able to conduct these accreditations on hospitals, and CMS accepts those surveys for CMS certification purposes. It just seemed to us that if CMS has gone through the process to do that, that we would also be able to do that.
Thank you, Chair.
Okay, I have a follow. Members, any other questions? Okay, I have a question for Dr. Nelson. Dr. Nelson, are you still on?
Yes, I am still here, but I cannot turn on my video.
Okay, I think that's okay. So,
okay.
If you've been following the questions, oh, there you are.
Yes.
And also I'd like to note in the testimony that the Department of Health is saying basically in their testimony what Mr. Ridley is alluding to, which is that the recognition process of the U.S. Centers for Medicare and Medicaid Services seems to be the impetus for this bill, that there's an assumption because the Department of Health has not included information about the specific standards of these other private accreditors, that there's an impetus for conformity with CMS and in following the CMS recognition process. Is there some sort of controversy or some sort of issue as it relates to CMS's recognition process of these private accreditors aside from the Joint Commission?
No. May I expound upon that?
Please.
I'd like to clarify that all accrediting organizations use the same basic set of standards or essential set of standards from CMS. The differences in the accreditation organizations come, each different organizations accredit different kinds of institutions. You just heard Bill 1150, which talked about accreditation for nursing facilities, I believe. We are speaking specifically about accreditation of hospitals, of which Hawaii State Hospital is one. There are only 3 other organizations that also accredit hospitals, and all 3 of them use the same basic set of standards set by the federal government through CMS. We believe that the Joint Commission's implementation of those standards sets it above the other 3 organizations that are currently recognized to accredit hospitals. We also believe that there are 2 other elements that strongly support the continued use of the Joint Commission in statute as the organization to accredit hospitals. And the biggest one is the Joint Commission's commitment to patient safety. I cannot emphasize enough that this organization has a robust tool that accepts complaints from anywhere. And more importantly, the Joint Commission follows up. They show up here on the Hawaii State Hospital campus to investigate complaints that they have received through their reporting tools. That means they flew somebody across the ocean to get here, and they showed up. Other organizations have not, to my knowledge, been able to demonstrate that same investigation capability. The second thing I'd like for the committee members to know is that over 75% of the hospitals here in the United States are certified and accredited by the Joint Commission, including the Mayo Clinic. That means that there are far fewer hospitals that are accredited by the other 3 institutions or organizations that have been named. As I said, of all the hospitals that require accreditation in order to receive Medicare funding, 75% of them are Joint Commission. That leaves fewer than 25% because some of those are critical access hospitals that aren't accredited in the same fashion, including 8 of our own hospitals here on Hawaii. And so it's a very, very, very small number of hospitals that you allocate these other 3 organizations to. There's just not a track record right now.
Okay.
Thank you.
Thank you very much. Members, any other questions? Okay. Thank you everyone for this robust and informative dialogue. We're going to move to the last measure on the agenda, SB 1140, relating to newborn hearing screening. This amends the newborn hearing screening statute to mandate reporting of diagnostic audiologic evaluation results to improve hearing follow-up of infants. First testifier, Department of Health.
Good afternoon, Chair. Matthew Shim, Chief of Family Health Services Division. The department stands on its written testimony in strong support, and we're here to answer any questions. Thank you.
Thank you very much. We have the Disability and Communication Access Board in support. Hawaii Children's Action Network in support. And Kaiser Permanente offering comments. Okay, that's all the testimony we've received. Members, any questions? Okay, seeing no questions, we are going, let me see if I have a question. Okay, I have a question for the Department of Health. The Department of Health still available for a question?
Yes, yes, Chair.
Okay, so it looks like Kaiser submitted testimony indicating that, from my reading of it, that perhaps the statute, the bill is worded in a way that would require reporting of hearing screening results of all infants. And I'm wondering if that was the intent and if the department would be amenable to specifying the required reporting of hearing screening results of infants who have been identified through the screening as deaf or hard of hearing.
Hi, I'm Sylvia Mann. I'm supervisor of the genomics section. Newborn hearing screening is under me. So what the bill does is that it does include the babies that fail newborn hearing screening and then get audiological diagnostic testing. We usually are missing about 40 reports a year. It's highly commendable that Kaiser submits the data to us, but I have to say not everybody does. We also have responsibility for children who fail the hearing test up to 3 years of age. So that's why any child that fails hearing testing up to 3 years of age should also be reported to the program, because the program links them to early intervention services so that they can receive the services needed to try to make sure that they're language ready for school. So those are the two groups of children who we're looking at to try to capture them, to get them into the early intervention as soon as possible so that they can be language ready. Audiologists have told us across the state that because our law specifically doesn't tell them they have to report to us, unless the state is paying for the testing, they don't want to report to us. And that's, we have the highest.
So if you can, excuse me, I think I understand that part of it and the impetus for the bill. I'm asking specifically about the requirement. It seems the way the bill is worded at this point, we are mandating the reporting of results of all infants, so not limited to infants who are identified in your definitions.
All infants who are identified as deaf or hard of hearing is the definition in the bill. We do not. Anyways, a child usually doesn't get diagnostic testing if there isn't a reason for them to get diagnostic testing. We don't randomly do diagnostic testing on children. We do public screening of children for hearing.
Okay, thank you. Members, any questions? Okay, we're going to recess for decision making. Recess. Okay, we are going to reconvene for decision making on this Wednesday, February 3rd, 1:05 p.m. health agenda to vote out a number of bills. So the first bill, SB 145, related to seeds and clones of cannabis products. What I'm going to recommend we do is incorporate the propagules and cuttings language from the next measure, SB 254, into this bill. Accept the Attorney General amendment capping the number of seeds, propagules, clones, or cuttings. And I believe we also have technical amendments. So we are going to combine SB 254 and 145 and move this on to judiciary. Any discussion? Okay, seeing none, Vice Chair, SD1, Chair votes aye.
Chair votes aye. Vice Chair votes aye. Senator Moriwaki.
Reservation.
And Senators San Buenaventura.
Aye.
Senator Favela.
Reservations.
Thank you.
Chair, your
Next
recommendation
measure.
is adopted.
Thank you, Vice Chair. Next measure, SB 629, which allows caregivers and out-of-state patients access to restricted access areas. I'm going to recommend that we delete the license transfer language, that we accept the Attorney General's office amendments and eliminate the references to employment for felons. And also, we have some technical amendments, including deleting Section 7 of the bill, because it's redundant and we moved it out in an act last year. Members, any discussion? Okay, seeing none, Vice Chair, SD1, Chair votes aye.
To Senate Bill 629, correct?
Yes.
Okay, Chair votes aye. Vice Chair votes aye. Senator Moriwaki.
Aye.
Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Your recommendations adopted, Chair.
Thank you very much. Next measure, SB 1139. This increases the patient registration fee and adds positions to the Office of Medical Cannabis Control and Regulation. I'm going to recommend that we accept the department's requested amendment establishing patient registration and administrative rules. We're also going to accept the amendments to clarify that the bill positions are intended to be funded for the biennium and not just a single year. There are additional technical amendments. Members, any discussion? Okay, seeing none, I recommend we move this as an SD1. Vice Chair.
A recommendation of the chair is to pass Senate Bill 1139 with an SD1. Are there any members present with reservations or voting no? Otherwise, I cast an aye vote for all members present. Measures adopted.
Thank you. Next measure, SB 1141. This is an administration measure related to hearing and vision. It looks like we have some technical amendments. So we're going to, I'm going to recommend that we move this bill out as an SD1 incorporating technical amendments. Any discussion? Okay, seeing none, Vice Chair.
Recommendation is to pass with technical amendments. Chair voted aye, Vice Chair votes aye. With the other three members on the call, any reservations or opposition? If not, I'll cast an aye vote for all members present. Chair, your recommendation's been adopted.
Thank you very much. Next measure, SB 1145, relating to the disclosure of vital statistics records. It looks like, so I'm going to recommend that we move out this measure with technical amendments, SD1. Any discussion, members? Okay, Vice Chair, SD1.
Recommendation of the chair is to pass Senate Bill 1145 with amendments. Any members present voting with reservations or in opposition? If not, I'll cast an aye vote for all members present. Chair, your recommendation's been adopted.
Thank you very much. Next measure, SB 1150, relating to nursing facility accreditation. I'm going to recommend that we adopt the Healthcare Association of Hawaii's suggestion that the language be clarified to make sure that it's clear accreditation is not compulsory. Accreditation with any particular organization is not compulsory. There are also technical amendments. So I recommend we move this out as an SD1. Members, any discussion? Okay, seeing none, Vice Chair.
Recommendation of the chair is to pass Senate Bill 1150 with amendments. Any member voting with reservations or in opposition? Hearing none, aye votes for all. Chair, your recommendation's been adopted.
Thank you very much. The next measure, SB 1151, is also an administration bill related to hospital facility accreditation. I appreciate the members and the testifiers for having an informative discussion on this. It does seem like there needs to be more education in the healthcare, local healthcare community, not only around the comprehensiveness of these private accreditors aside from the Joint Commission, but also on the CMS recognition process. So given that fact, I'm going to recommend that we defer this measure and we can try it again next year. Any discussion? Okay, so we're going to move to the last measure on the agenda, SB 1140, relating to infant hearing screening. My recommendation is to amend Section 5 of the bill to just clarify that the required reporting will relate specifically to screening results of infants who have been identified as deaf or hard of hearing, and that the bill is not aiming to capture screening results of all infants. There are also a number of technical amendments, so I recommend we move this as an SD1. Any discussion? Okay, seeing none, Vice Chair. SB1.
The recommendation of the chair is to pass Senate Bill 1140 with amendments. Anybody voting with reservations or objections? If not, I votes for all. Chair, your recommendation is adopted.
Thank you very much. We are adjourned.